Hello my dear students and my dear friends, Assalamu alaikum and welcome back to lesson for you dear friends. In the previous video I have introduced the tibia bone, right? So the lectures before that we have discussed about the femur bone, and this is a typical tibia bone which I have in my hand, and this is also known as the shin bone, right? So this is the bone of the leg. The first important thing is that the tibia is the bone of your leg, right? Then it is located anterior medially, right? It is located anterior medially. Okay, then it's at its upper end, it makes joint with the lower end of the femur bone, that is called the knee joint, and in its lower part it makes joint with the tarsal bones, and that is called the ankle joint. We will discuss that later, right? And the next important thing about it is that it is a typical long bone. The tibia is a typical long bone, so it must have an upper end, a shaft, and a lower end, right? Right now in the lecture before we have discussed about the important external features of the upper end of the tibia. Now let us see all these important features in this typical bone itself, right? Look carefully friends. First, the upper end of the tibia is a little bit broader, the lower end is a little bit narrower, right? Then in its upper end it has two condyles, right? The medial and the lateral, right? The next thing is that how to determine either it is a right tibia or the left tibia, right? As I have in my hand here three tibia bones, right? So one should know that how to determine this, either it's a right tibia or the left tibia. So for in case of to know about the side determination, we should remember two important things. And what are those? Easily, here in the interior aspects of it, there is the tibial tuberosity, right? This is the tibial tuberosity. So the first thing is that the tibial tuberosity should be kept interiorly, right? As there in the posterior aspects of it, there is no tuberosity. So this is the tubercle, this is the tuberosity of the tibia. So it should be kept interiorly, the first thing. And the next thing is that this is the malleolus of the tibia, right? This is the malleolus of the tibia. So the malleolus of the tibia should be medially. Then you will easily recognize either it is left tibia or right tibia. The two important points. The first, the tubercle, the tuberosity should be interiorly. The next, the malleolus should be medially. It will be easily understood. Look carefully. Medially. Look, if I keep this tuberosity anteriorly, right, and I say this is the right tibia. So if you keep the tuberosity interiorly, but if you say that this is the right tibia, so look, the malleolus has gone laterally, right? If you consider this tibia as the right, the tuberosity is interiorly, okay, but the malleolus has gone lateral. Now bring it here. This is the tuberosity again interiorly, and the malleolus is medially to the midline. So we say this is not the right one, this is the left tibia, right? So the tuberosity should be interiorly, and the malleolus of the lower end of the tibia should be medially. So you will easily recognize this as the right or left tibia, right? Now let us see all the important external features of the upper end of the tibia, as we have divided it into an upper end, a shaft, and a middle and a lower end. We will see them in the next lectures. Look carefully. First, there are two condyles. In the upper end of the tibia, there are two condyles. That's so simple. There is a medial condyle, and then there is a lateral condyle, right? So here is your lateral condyle. Okay friends, look, these two are the condyles. As this is the left tibia, so this will be the medial condyle, and this is the lateral condyle, right? So the medial and lateral. Both these medial and lateral condyles have articular surfaces. Look, here are the two articular surfaces of, this is the articular surface of the medial condyle, and this is the articular surface of the lateral condyle, right? So here the condyles of the femur bone will fit here and they will make the knee joint, right? So these are the two condyles, and these are the articular facets of these condyles, right? Next, there is an intercondylar area. I had told you there is an intercondylar area. In between the two condyles there is an area which is called the intercondylar area, as I have mentioned it with this red color to you guys, right? So medial condyle, lateral condyle, intercondylar area, right? The next important point about it is that there are tubercles, right? There is the tubercle. Look carefully. Here we have a tubercle which I am mentioning it with blue color, and here we have another tubercle, right? Okay, so look carefully. This is the medial side and this is the lateral side, right? So we say this tubercle is present on the medial side and in between the two condyles. That's why we say that this is the medial intercondylar tubercle, right? And then there is the lateral intercondylar tubercle, right? So here are two elevated parts. This is the medial intercondylar tubercle and this is the lateral intercondylar tubercle, right? Look, medial condyle, lateral condyle, articular facets, intercondylar area, and medial intercondylar tubercle, lateral intercondylar tubercle, right? And this elevated part of this intercondylar area, as you can see, this is a little bit has gone upward, so this is called eminence. So we say intercondylar eminence, right? There is again medial condyle, lateral condyle, articular facets, intercondylar eminence, intercondylar area, medial intercondylar tubercle, lateral intercondylar tubercle, right friends? These are some important points. Next important things about it is that there is a tibial tuberosity, right? This is the tibial tuberosity, okay? And this tuberosity is divided, as I had told you in the video, that it is divided into two parts, the upper part and the lower part, right? So this is divided by the epiphyseal line, as I had told you. Here will pass your epiphyseal line. So this is epiphyseal line, and the epiphyseal line divides the tibial tuberosity into an upper part and a lower part. So this is the tibial tuberosity, right? Next important thing about it, we discussed that the tubercles are discussed. Next important thing about it is that there is a groove, right? Here medial condylar groove, and here is another groove which is called the lateral condylar groove. So here is a depressed part, you can see with, I have shown with red color, right? If you can see it clearly, okay, this is the this is the medial condyle. So here is a groove which is called the medial condylar groove, and here is another groove which is called the lateral condylar groove, right? And you can see here is a facet which gives attachment, which makes joint with the upper part of the fibula bone, and this is called the fibular facet, right? Here is a small face. Facet means small face. So this is the fibular facet in this part, right friends? And then there is the epiphyseal line is there, okay? And another important thing that I had told you, that there is a tubercle which is called the Gerdy's tubercle also present there. So here is a tubercle which is called the Gerdy's tubercle also present here, right friends? So what did we learn up to now? Let's fastly recap and memorize it forever. Look, this is the upper end of the tibia. It has a medial condyle, it has a lateral condyle, right? It has a medial condylar facet, or we say articular surfaces of the medial condyle and articular surface of the lateral condyle. There is intercondylar elevated part which is called the intercondylar eminence. Then there is an area in between the two condyles which is called intercondylar area. Then there are two tubercles present here. One is present medially, one is present laterally. That's why we say this is the medial intercondylar tubercle, and this one is the lateral intercondylar tubercle, right? This is the tibial tuberosity, which is divided by the epiphyseal line into an upper and lower part, right? Then there is the medial condylar groove and lateral condylar groove. This is the fibular facet, and here we have the Gerdy's tubercle also. So friends, this was about the upper end of the tibia, or we say the external features of the upper end of the tibia. Now in the next lecture we will go towards the shaft of the tibia, and we will discuss about its borders and its surfaces, as it has 3 borders and 3 surfaces. So see you guys in the next lectures. And I so also, my dear friends, please tell me about the new method of my teaching, that either you guys like it or not. So see you guys in the next lecture. Till then, Allah Hafiz.